Hello, my name is Dr. Goliaei, and I'm here today to talk about Introduction to Postpartum Care. I would like to thank you, my co-contributors, the California Refugee Reproductive Health Network, or ReproNet, and the Patient-Centered Outcomes Research Institute. ReproNet was founded in 2019 to strengthen refugee academic community partnerships and engage in dialogue with refugee communities about their experiences and preferences for sexual and reproductive health and well-woman care. This network includes researchers, refugee women, and health and social service providers who serve refugees. I have no disclosure. Let's get started. So, what is a postpartum period? The postpartum period is the time after a mother gives birth and is defined as the first 6 weeks after delivery. The days and weeks after childbirth are an important time for both mother and baby. Mother needs to take care of herself and recover and adjust to new motherhood, experiencing many physical, social, and psychological changes. Following birth, many cultures prescribe a 30-40 days period of rest and recovery, with the woman and her newborn surrounded and supported by families, friends, or community members. This time period of 40 days or 6 weeks is encouraged in different cultures for mothers to take special care. In Afghanistan and other countries with similar cultures, new moms are encouraged to stay home with the baby for 40 days, try to rest a lot, and get extra help from families. During this talk, I want to make you familiar with the checkups and visits that a mother needs during this period. Also, emphasize mostly on, although your baby's health is priority, and you need to take care of the baby's needs, well-being, checkups, and immunizations. However, you also need to take care of yourself. A new mother during the period after delivery, at first and most, needs to get plenty of rest, ask for help, eat healthy meals, and start some exercise. During the postpartum period, the new mom needs to stay connected with her maternal health providers or OBGYNs. As you all are familiar with prenatal care and received your prenatal care here in the United States, there are also postnatal checkups or care. Usually at the time of discharge in the hospital staff will help you within the force to schedule an appointment for the checkup. All women should ideally have contact with the maternal care providers within the first 2-3 weeks. These first 2-3 weeks depends on the mother's new health condition or any complications during the delivery may change. You may need to see the providers earlier or later. This initial assessment also should be followed with an ongoing care as you may need. And also, it will conclude with a comprehensive postpartum visit no later than 12 weeks after you're giving birth. When you're leaving the hospital, you should know when and where you will go in for these visits. And remember, this visit is separate from your baby visits, which you need to schedule that before you leaving the hospital too. Any question before we jump to the visits? I have a question for you, and I want you to think and let me know if these statements that I'm reading for you is true or false. So the statement is, mothers should only focus on their baby's health and well-being. What do you think? Yeah, As I mentioned before, self-care is necessary for you. You need to be healthy to be able to take care of babies and the other kids and the other family members that you have. Take care of yourself during these 40 days or 6 weeks after delivery is essential for your long life recovery. Before we talk about postpartum care visits, I want to emphasize that after you discharge from the hospitals, until you go to your first postpartum visit, you need to be aware of your overall health and well-being. There are some changes that if any of them happened, you need to call your doctor or a healthcare facility. Some of these symptoms could be if you have a fever of 100 Fahrenheit or 300 centigrade or above, or if you feel trouble breathing or chest pain. If you have severe headache, dizziness, or lightheadedness. You also need to call your doctor or healthcare providers if you have a heavy bleeding, which could be 1 pad per hour, or you discharge big clots. Any changes in your vision, the way you're seeing things, should be addressed and checked by providers. And also, if you feel you may harm your baby or yourself or anyone else, you need to immediately ask for help and contact the healthcare providers. Before you go into your visits or your checkup, you need to take a notes of anything you want to ask or discuss with your providers, your doctors. Anything that make you worry, any changes, any questions that you may have, take a note of that and bring your notes with yourself to your doctor. Also, during the visits, when your doctor finished the conversation, you should ask your doctor if there's anything that is unclear for you or has not yet been addressed. Remember, always it's okay to speak up during the clinic visit. Ask for more information and for more resources. And also confirm the accuracy of any information that you may receive from your family, your friends, your community, or social media. Now, let's review what you really expect during the checkup or postpartum visits. The postpartum visits should include a full physical, psychological, social, and your overall well-being. It could include mother recovery from birth, contraceptions, mood, emotional well-being, sleeping and fatigues, chronic disease management, and health maintenance. It also will include some aspects of infant cares and feedings. Your providers usually first checks your vital sign. It includes if you have any fever, check your blood pressure, maybe check your blood glucose levels. Depends on if there was any complication during the pregnancy, if you had high blood pressure, if you had diabetes during the pregnancy, that needs to be addressed more. Your providers also will check if there is any swelling in your face or in your hands. They also will check your vaginal bleedings and also your healing of your wound. If there was any stitches during the vaginal delivery, or if you had a C-sections. Your doctor or your providers also will talk about your nutrition. you have to receive the postnatal vitamins. Vitamins are not only for prenatal period. You have to continue on your vitamins. Your doctor will talk about your diets, your bowel movement, any sign of constipation that needs to be addressed. Your providers, your doctors, also check on your breast and nipples. Breastfeeding is one of the most important topics that needs to be addressed both in the hospital, after delivery, and in the postpartum care. You may want to think and make your decision about the breastfeeding and talk to your husband or your partner before the delivery. If it's your first time breastfeeding, you need to ask help and get more information from the providers, both in the hospital and in your visits. You need to know more about the benefits of breastfeeding for your baby's well-being and for yourself. Here are some of the benefits that breastfeeding could have for you. Breastfeeding could help lower the risk of breast cancer and ovarian cancer for a mom. It also may help with decreasing the chance of rheumatoid arthritis and endometriosis. And it may help with decreasing the chance of osteoporosis. It also could help with decreasing the chance of diabetes, hypertension, and risk of cardiovascular disease later on during the life. When you first start breastfeeding, the first milk that comes is colostrum. Colostrum usually is thicker and more yellow than the milk, normal milk. This first milk is perfect nutrition for your baby and helps with the digestion and development of the baby's immune system. In your postpartum care visit, your providers will talk about your breastfeeding and will check your breast and nipples. There may be some issues with your breast and your nipples, which could be a sore nipples, a painful engorgement in the breast, or a yeast infection that needs to be addressed. You may want to ask help about your position on how you're breastfeeding your babies. If your milk is not enough for your baby, or there is any other issues that needs to be addressed, your providers may suggest you to add baby formula. Breastfeeding also could be used as a method to help you to prevent next pregnancy. However, this using of breastfeeding as a contraception only could be benefits during the first 6 months, and only if you're doing exclusiveness breastfeeding. Exclusively breastfeeding, that means you don't give the baby anything else, only milks, and at least every 4 hours during the day and every 6 hours during the night, you breastfeed your baby. And it only works until you have your first period or the less than the 6 months before you start feeding baby with other foods, solid foods. However, sometimes you may get your period even before these 6 months and become pregnant without even you notice. So you may want to think about using other birth control methods while you're breastfeeding. As I talked to you about the breastfeeding as a way of birth control during the first 6 months and how that could be helpful, we need to talk more in depth about the sexuality and family planning after the delivery. You cannot start having sex after the 6 weeks. But remember that you may become pregnant anytime without even you notice if your period gets started. Birth spacing And distancing between the kids will help you and your body to have enough time to recover and heal after one birth, and will support you to be able to support the baby that you have, to be able to do your breastfeedings and take care of this baby, and also will prevent some of the complication for next pregnancy or the next baby that you may be pregnant. So it's always good to think about birth spacing while you are breastfeeding. Using condoms while you are breastfeeding could be a good way to prevent from unplanned pregnancy. You need to talk to your providers, and your providers will talk to you during the postpartum visits or care about the method of choice that works best for your body, for your family, for your social, physical, mental, and all the necessary aspects of your life. And you may choose the best that works for you with the supports of your husbands, your partner, and your providers. During the postpartum visits, your providers not only will talk to you about your physical health, but also they will talk to you about your emotions. The hormonal and physical changes that your body is experiencing, along with lack of sleeps and new responsibilities and new family structures, could bring some stress for you. And these are overwhelming. Baby blues, which is the new mother's emotional change, is common. And over 80% of women will experience symptoms like mood swings, crying, and anxiety, and difficulty sleeping after giving a birth. What you need to know is it's okay to have this feeling, and it's okay to ask for help. Talk about your feeling with your husband, ask for help from your husband, from your family and friends, and from community volunteers. And during your postpartum visit, talk to your doctor or your nurse and get help from healthcare providers. Ask for more resources. Ask if you can talk to a therapist or a mental health provider. There are lots of supports in the community, including support groups for new moms. You also can contact your caseworkers and ask if they can connect you with some of these support groups or some of the providers that you can talk to them. Again, I'm emphasizing that asking for help is actually empowering you, because you get to know your own capacity and your own needs and stand up and talk about your own well-being. If those emotional changes stay longer than 2 weeks or get more severe, it may change to postpartum depression. In the United States, based on some of the researches, 1 in 8 women may experience postpartum depression, which is a common symptom. Symptoms of postpartum depression are: you may cry more often than usual, you may have feeling or anger or feel withdrawal from your loved ones, you may feel disconnected from your baby and worry that you may hurt your baby. If you have any of these symptoms anytime during your postpartum periods, you need to contact your healthcare providers and talk to your doctor or professional mental health providers. After these 6 weeks or this first postpartum period, you typically back to your normal life. and have all your responsibilities around the kids and homes. At this time, you also need to continue taking care of yourself with getting enough rest and enough nutrients. Physical activity and exercise should be part of your routine schedule. At this point, you need to contact and connect with your primary care providers. You need to have a long-term healthcare plan for your ongoing condition. If you have any ongoing condition like hypertension, diabetes, obesity, or asthma, and also you need to taking care of yourself and thinking about cancer screening that you may need, like mammogram or pap smears. So again, I want to remind you that you need to take care of yourself and stay healthy and have more energy to take care of your family and your babies. Any question? If you have any question or concerns or need more resources or interested in more information, you can contact us through the ReproNet Facebook pages, or also you can email us or email your caseworker and let us know that you need more information or resources.